Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. For those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review videos, review books, review materials, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that we see here are designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a patient presents to the office today for follow up. The patient denies any complaints at this time. Upon examination, the nurse practitioner notes the patient's blood pressure is 124 over 82 today. Based on these findings, how should the nurse practitioner treat? Is it A, initiate chlorothalidone, B, initiate lisinopril, C, instruct patient on implementing lifestyle modifications, or D, nothing at this time. This is a normal blood pressure reading. Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first. The stem of the question is the end of the question with the question mark, what they are really asking you. And I tell y'all this because it allows you to really pay attention closely to what's being asked before getting into all of the things in the scenario so you're not making careless mistakes or missing key points that they're looking for. So the stem of the question here states, based on these findings, how should the nurse practitioner treat? You know what I say, if they're asking for treatment, you need to run it back a step further, look and see if they provided you with a diagnosis, and in the event they have not, go back a step further and look at the assessment findings so that you can determine a diagnosis. Here, we're managing blood pressure. This patient came in for follow-up, denies any complaints. The blood pressure is 124 over 82 today. So being familiar with the blood pressure goals and knowing that what guidelines we're following, your ACC and AHA guidelines, correct? So 124 over 82, although it's not something we're so alarmed about, it is considered pre-hypertension. Anything exceeding that 120 over 80 range before you get to that 130 over 80 range is considered pre-hypertension, and you want to initiate lifestyle modifications so that we can try to balance this and prevent them from increasing and getting more elevated. So your best answer here is C, to instruct the patient on implementing lifestyle modifications. And when you study this, don't just know that you want to do lifestyle modifications, understand what are the lifestyle modifications. So, instructing them on the DASH diet, which is a low sodium diet, right? And advising them on exercising at least 5 days a week for 30 minutes each of those days. And you can also instruct them to do if they're doing high intensity exercises, instead of doing the 150 minutes per week, they can do 75 minutes per week. And I say always study in that fashion because a lot of times we know things like this. Like, this seems simple. You know that it exceeded 120 over 80. All right. You knew it was pre-hypertension. All right. You knew they needed to do lifestyle modifications. But then when the exam tells you a specific lifestyle modification, instead of using the term lifestyle modification, for example, them explaining details of a DASH diet, and then you haven't really reviewed that, that's where y'all make those mistakes. And so I always say make sure that you are studying in these steps so that you can pivot any way that the questions are provided to you and fill those gaps so you're not missing those small places and on exams. Question number two. The patient returns to the office for review of his blood pressure. He provides the nurse practitioner with his blood pressure log from the last 30 days. The nurse practitioner notes that despite implementing lifestyle modification, the patient's blood pressure has ranged from the 140s to 150s systolic, and the diastolic readings have been in the 90s over the past 30 days. The patient denies any past medical history. What is the next best steps by the nurse practitioner? Is it A, to initiate chlorothalidone, B, initiate lisinopril, C, continue lifestyle modifications, or D, initiate amlodipine? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, what is the next best steps by the nurse practitioner? So let's see what we are so we can determine what is the priority to do next. They're asking you for the next best step. We're looking for priority answers, right? So this patient is returning for follow-up for the management of his blood pressure. He has a 30-day log of his blood pressure readings, has been doing lifestyle modifications, but his systolic readings have been 140s, 150s, diastolic in the 90s. We know this is completely abnormal. It's actually the third tier that we follow with ACC and AHA guidelines, meaning patients who are healthy with no comorbidities, you do not want them to exceed 140 over 90. We don't want anybody to exceed that, but if you're healthy, we can gauge a little bit further and give you more wiggle room with your blood pressure. And if it exceeds 140 over 90, we go ahead and initiate therapy. In the past, sometimes we'll bring you back, do all the things, but guidelines state if they're exceeding this and they don't have comorbidities, now it's time to initiate therapy. So we know we need to initiate something. We don't need to just continue lifestyle modifications. We're doing that, but yes, continue it, but they need medications on board. So that's when you need to consider your first line therapies and how you treat. So we know this person, it doesn't talk about any of their background. They don't have any past medical history. So they really can have any of the blood pressure medicines, but remembering that thiazides are the top of that first line therapy list. So the best answer here is A, to initiate chlorothalidone. All right, and question number 3, an African American male patient presents to the office today for the management of his blood pressure. He has a history of COPD and gout. His blood pressure today is 148 over 90. How should the nurse practitioner treat? Is it A, initiate chlorothalidone, B, initiate lisinopril, C, initiate amlodipine, or D, nothing at this time? Tell me what you got. All right, so STEM here is how should the nurse practitioner treat? So what are we treating? So we've been continuing on this blood pressure series, and I'm trying to provide y'all with various scenarios, I should say, for blood pressure, because when I'm doing one-on-one sessions, I notice that sometimes we get tripped up on this. So I want to make sure that y'all know and understand every angle that you can pivot with blood pressure. Again, as we talked about with tier 3 with ACC and AHA guidelines for hypertension management, exceeding 140 over 90 for healthy people is when we initiate therapy, but we initiate therapy if it's greater than 130 over 90 for the second tier, right? With people who have comorbidities. This patient has a history of gout as well as COPD. So we know they're over that number. We definitely need to initiate some type of therapy as far as medications, right? Okay, so now we want to go through all of the steps. What are they telling you? They're letting you know that this patient is an African American male. This is significant because with the African American population, we treat first line with thiazides or calcium channel blockers. African American population respond better to thiazides and calcium channel blockers, and actually they respond best with both of those combined. So when you are providing treatment, you want to start with your thiazides, then go to a calcium channel blocker, okay? If they tell you it's an African American patient, or if you're treating an African American patient in practice, right? Now, of course, if they're diabetic, if they have chronic kidney disease, you will alter and consider your ACEs and ARBs for renal protective measures, but they don't say that he has a history of any of that here. It's just COPD and gout, right? Okay, so now we're considering thiazides and calcium channel blockers. But key detail, this patient has a history of gout. Gout is one of those contraindications for thiazides, right? So you want to skip the thiazide and go to the next second line therapy, which is your calcium channel blocker. So C here is your best answer to initiate amlodipine. That's your calcium channel blocker here. Know your endings, pine, peen, are calcium channel blockers, and that is best for this scenario. Okay, so initiate amlodipine. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any other resources that I offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1, at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. Both are linked in the bio of this channel. You're able to view and see what these are like. It is broken down by system, designed for family and adult gero in preparation for both exams. It does include a non-clinical section, pictures, images, into charts to help you tie things together, as well as 175 practice questions and rationale are included. If you are someone who prefers to study independently, I do offer a self-paced review for family and adult gero provided for preparing for both exams. That's also linked to the bio of this channel. If you go to the main page and look at the bio, you will see all the links to the website, and it's broken down to tell you ebook, paperback book, self-paced review. Just click on the links and it'll take you through, give you full description, pricing, and anything that you may have questions about. And if you still have any questions, shoot us a message, let us know so we can help guide you. Next is our 5-week group review. Now, this is for family and adult gero. This is the last one for the year. We do have 3 spaces remaining. If you're looking to join, it's broken down over 5 weeks. And then the final week, we have an individualized week where I do one-on-one sessions with each of you to help guide you and prepare you for your next steps after completing the class. That's linked in the description of this video. Next, y'all know I'm so excited that my QBank is out. That is now linked in the bio of this channel as well. So QBank, let me explain how this works. There are multiple options, and I designed it this way to help based off of how you may be preparing. Everybody likes to do things a bit differently. So I do have the mini practice quizzes. So the mini practice quizzes they're 10 separate quizzes with 10 questions at a time. You know, I tell y'all to study in smaller increments when you're first starting out so that you're testing how you are applying, but allowing yourself time to review those rationales, not trying to do so many at once, but you're going to build your muscle memory and build that stamina to be able to do more than 150 questions, right? So that the mini practice quizzes, you can purchase that separately studying. And with that, just like I do these videos, it provides the answers and rationale in a video form to explain it and help walk you through. So when you're studying, you can utilize that to help gauge and prepare more. And that is $39.99 on a subscription basis. But that is in you'll see the link. It's separate for that. And then you can purchase Practice Exam 1 and Practice Exam 2 separately as well. Those are $59.99 each as well. Practice Exam 1 has 175 questions, and it is designed in the format of the ANCC exam. And Practice Exam 2 has 150 questions, and it is designed in the format of the AAMP exam. Now, you can choose any of those if you would like in that format to just do those separately, or you can get the entire bundle for $99.99. And that will include all of those things that I just mentioned. And it is linked that way in the bio, each one separately as well as the bundle, okay? And then lastly are the one-on-one sessions. You know, I always say reach out for the one-to-one sessions. Reach out to us just because they are customized so that you can gauge what you truly need. But the offers that I do for one-on-ones are you can book a session for 1 to 2 weaknesses at a time. You can book an exam readiness assessment, or you can book the custom package. You are provided with a pretest initially based off of the timeline that you're looking to a lot to study, and I structure a study schedule and plan for you based off of your strengths and weaknesses to be completed over that duration of time that you're looking to study. And I work alongside with you during that time frame to take you to a successful exam attempt. So again, if you need any of those resources, feel free to reach out to us at the Nursing Studio. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.